The Nigerian federal government has received intervention funds from diplomatic agencies in an attempt to combat the outbreak of diphtheria in some states across the federation. The Secretary General of Nigerian Red Cross Society, Abubakar Kende, made this known while speaking to a cross-section of newsmen in Abuja, saying that the fund received by the government will complement its effort in response to the outbreak of the disease in some affected states. The Secretary General, who was represented by a director in the society, said the received fund will provide surveillance and immunization in order to reduce the impact of the disease in the affected state across the federation.
Diphtheria is a very serious infection caused by particular bacteria and can lead to difficulty in breathing and can also lead to death in some severe cases. So in response to this diphtheria outbreak, the European Union and the International Federation of Red Cross and Red Crescent is providing funds to Nigerian Red Cross to complement Nigerian government efforts in response to the diseases in the most affected states, which are Kano, Katsina, Lagos, and Osun states. So Nigerian Red Cross will be partnering with the Nigerian Center for Disease Control and also the National Primary Healthcare Development Agency to roll out a 3-month emergency operational plan which will support demand generation, surveillance, and also immunization in order to reduce the impact of the disease on affected population and also at-risk communities. We at Nigerian Red Cross firmly believe that with just a little more attention to hygiene and massive public enlightenment, the outbreak can be curbed.
Some of the activities that will be conducted by the Nigerian Red Cross Society will be social mobilization for the increase of uptake of diphtheria vaccines and also the routine immunization, and then also supporting the NCDC with contract tracing and active case search of diphtheria in the affected communities. We are also going to be training our volunteers to go out into the communities to sensitize mothers and also children from age group of 0 to 5 years, and in some cases up to 14 years of age for the routine immunization. The project is going to last for 3 months, and the budget for now it's about 355,000 Swiss franc, and is specifically for the only selected states, which is Lagos, Kano, Osun, and Katsina State. The criteria for selecting those states, because they are one of the highest reported cases, suspected cases, and confirmed cases of diphtheria, and they also, for example, Kano State has the highest local government areas, about 19 LGAs that are currently reporting cases of diphtheria, and also Lagos as well is also one of the epicenters, and also for Katsina State has high number of children that are unimmunized with routine immunization, Penta 1 and Penta 2, and also the diphtheria vaccines. And then Osun State as well also submitted a request for support from the Osun State Governor's Office. If there is any need to add more states, because obviously the diphtheria outbreak is still ongoing, and a couple of new states have reported cases of diphtheria, for example, Cross River, Kaduna, and also other states are also experiencing the same outbreak. For now, we are just focusing on 4 states, but this is currently being reviewed. The symptoms of the disease is usually from high running temperature, fever, also coughing, and having like a sore throat symptoms when it comes to your throat, your coughing, and also having high pressure chest area. So, but once you feel like you have any slimy mucus under your throat, you should refer yourself to the nearest health facility.